13 minutes after the hour now, in the morning mix continues right here at 1430 WCMY from the First National Bank of Ottawa studio. Joining me right now is Dr. Cleamon Moorer. He is the founder and CEO of American Advantage Home Care Incorporated, which serves home health care services to homebound patients in Detroit. We're going to talk about the truth about nursing homes, but a minute or so ago, we were both commiserating about this horrible weather. I understand you're getting it too, Doctor.
We sure are, Maggie. Over here in Metro Detroit area, there's some snow flurries today.
You know, let's start. Do you have, first of all, talk about a little about your background, because you're actually, I believe, started in the healthcare business and now to evolve into home healthcare services. Was that a natural progression, or did something kind of propel you in that direction?
Well, Maggie, a combination of both. I was propelled in it through a consulting opportunity where I was tagged to work with a local agency here in Metro Detroit on some business development and operational strategies. And from that opportunity, I saw where the need for home health care was so big, and I saw where there were gaps in terms of how to get to patients and how to inform patients that, hey, this is an opportunity for you to have care within the comfort of your own home.
You know, when we look, I can't even imagine the numbers as we look, but it has to be an increasing number of our population that's aging.
Yes, ma'am. It is. It is. So the estimates, the youngest baby boomer, so if we go back to World War II, 1941 to 45, that youngest baby boomer by 2030, that's would be the last set that are turning 65. And Maggie, that's estimated to be 74 million U.S. residents that will be at least 65 years old.
You know, Doctor, I remember when did the attitude about skilled nursing care or nursing homes change so drastically? I remember I'm at the younger edge of the baby boomers here.
Yes.
And I remember sometime in the 70s, my father was kind of tasked to look out for some extended care for my grandmother. It was a no-brainer. A nursing home was the best option. When did home health care really start to get some wheels and traction?
Yeah, so I will have to say, Maggie, most recently. So perhaps within the last 3 to 5 years, for sure. And I think a lot of it has to do with the increasing costs of running, nursing home facilities. Mm-hmm. And then last year with the pandemic, the COVID-19 pandemic, the focus on home health care as an option really exploded when nursing homes became ground zero for the pandemic. So definitely within the last 3 to 5 years, home health care has been upwardly ticking, but as of last year in COVID, it's taken off even higher.
Is there a different set of problems, though? Besides actually the spread of the virus, do you see an increasing amount of problems within these facilities now that you might not have pre-2020?
Well, yes, I will have to go there, Maggie. A lot of it has to do with the labor market. So the readiness that some professionals should have whenever they go into a nursing home facility. We found that some caregivers are unequipped, partly because of perhaps their training and education as just becoming a medical assistant, as opposed to being a certified nursing assistant or a licensed practical nurse, an LPN. We've seen where in some settings there is a lack of skilled professionals inside of some nursing home facilities. And then in addition, the review processes, so accreditation for nursing homes every 3 years to 5 years. So there are a lot of nursing home administrators who are able to put on their best face for accreditation or recertification of their licensing, but their daily operations frail oftentimes in comparison to what they're able to present during an accreditation cycle or window.
Do you see a difference between, in our area, we have what I guess I would call it a private nursing home versus we do have a county nursing home. Do you see a difference in patient care there?
Yes, there is a difference. Yes, there is. So oftentimes county facilities that are ran, funded, operated as a local government entity stand a greater chance of adhering to regulations and policies because all eyes are on them. All eyes are on county hospitals, public facilities, public clinics. Not to say that there aren't challenges there from budgeting standpoints, but there is a greater attention focus. Whereas some private entities that are owned and operated by hedge funds or capitalists to an extent, many of them don't always have the attention of the patient first of mind or the attention of the family. So a lot of groups are owned by investors with really deep pockets that don't necessarily have a heart for the people and the communities that they own and run operations in. So we're finding that to be somewhat of a challenge in some inner city areas.
And I've read about these facilities that claim to be nonprofit, and my initial thought is that's a bunch of hooey. Am I?
Yes.
Am I?
Maggie, you got to make some money.
Yes.
You got to make money.
Yes. Sorry about that. It's been a long morning. I apologize.
No, it's one thing to claim, okay, I'm not about profit, but you got to be about impact. And in order to be about impact, you have to have a sound business model, right, that focuses on quality, that focuses on compassion and care. You have to be that, But I've heard of many of the not-for-profit outfits, but we got to be about impact, and that requires making some revenue, certainly.
And before we... Before we get into the benefits of home health care, I'm curious as to your thoughts about these, I guess you'd almost call it retirement complexes, where it's actually, a couple might go in relatively good health, have a home or a duplex. Then if something happens, they are moved to perhaps an apartment, to a bit of assisted living, and ultimately, in some cases, skilled care. Good or bad?
Yeah. So it depends on the health care, the trajectory, so that wellness and that age cycle. So the retirement community that has individuals that are vibrant in their early to mid-60s, early to mid-70s, and have some loved ones and children that can see after them, and their health being a natural progression of decline, that's fine to go in those stages, But for the abrupt changes, we want to be watchful of that. If there are abrupt declines where people move into retirement communities and they're depressed, where they feel disconnected and it's not quite the vibrant community that it should be for seniors, we have to do a much better job, Maggie, of working to create those social ecosystems that enable and allow seniors to still have a high quality of life, even if they are in a retirement community.
I understand that that seniors overall would possibly prefer to be cared for in their own homes or that of a loved one. But when it comes to home health care and nurses and aides, how do we protect that senior who's in need of help so there's not a repeat of problems that may have happened in a facility?
Yeah, so I would have to add that, video surveillance for families is a good idea. The doorbell ring app is good. Having continuous conversations with that home health care company where there's check-ins as related to the multiple disciplines that may be providing care, so between the nurse and the therapist and the home health aide, those individuals should be an extended family to the children and the loved ones of the elderly. So I would really suggest that listeners identify an agency there in the Illinois area that they feel that connection to, where there's a high trust factor. Look at the patient satisfaction scores through CMS. Look at the quality of care star ratings. Also, look at Google ratings and Yelp and Bing. All those online tools actually tell a story about the type of agency that will be best to partner with.
I am talking to Dr. Cleamon Moorer. He's a best-selling author from Failure to Promise, 360 Degrees. I have to ask, now let's talk a little bit about the pandemic, and we've had so many instances here, two that I can think of in local nursing homes where, try as they might, they were not able to contain this virus. This continues to be a problem, yes?
Yes, it does. Yes, it does. So the variants, I think the variants are a challenge in view of the virus. A lot of the schools have reopened, so they're not just online or hybrid. And you got youngsters, young kids that say, hey, I haven't seen grandma in a year. And I can't get vaccinated as a kid if I'm 8 or 9, but grandma's got vaccinated, so I still want to visit. So I do see where there's a lot of movement with young children, teens, and even the college-age students that went on spring break, Maggie. I mean, a lot of kids went to Florida as if we're not still in the pandemic, So I'm for the cautious reopening and reinstitutionalizing some of our sporting events and gatherings and the like, but we still need to be extremely cautious.
I would say as we look at the nurses and healthcare aides who might work for a home healthcare business, I would think they would have to be possibly even more engaged, working one-on-one with a senior in their home.
You know it. Yep, more engaged, and we have to do daily screenings of our employees, as well as continue to encourage infection, disease management, infection control, and even encourage, we cannot mandate that all of them get vaccinated, but certainly encourage and educate on the vaccines.
No,
and then encourage
No, go ahead. I'm sorry.
Yes, and also allow them to inform and educate the families and the patients of the homes that they go into about best practices as related to infection control.
Well, Doctor, you are just a bounty of information. Now, I do know you've got a weekly or biweekly podcast. People want more information. Is that the best way to get it?
It is. Absolutely, Maggie. The homehealthcaretoday.show is the web address to our biweekly home healthcare podcast, where we cover a broad array of topics. And it's a YouTube channel for the Home Healthcare Today show. And the podcast itself is available on Pandora, Apple, Google, wherever you listen to podcasts, you'll be able to find the Home Healthcare Today show.
Perfect. Before I let you go, anything else you want to share with my listeners this morning?
Well, Maggie, yes. I always be a fan of Illinois. All four of my sons were born in Illinois. I met my wife in Illinois in 1999, so it is a home away from home. So proud, very proud of the state of Illinois and the home health care arena there.
Oh, it was very nice to meet you. I feel a little bit better knowing we're sharing weather today. So don't shovel, it'll melt.
You sure are, Maggie. You be sure to have a wonderful, wonderful rest of your day, and thanks for having me.
You too, sir. Thank you so much. Be safe.
You too. Thanks, Maggie.
That's Dr. Cleamon Moorer. And the morning mix continues after this.